Israel bombs one of the last working hospitals in Gaza, a place where usually treatable health conditions can now mean death. Targeting health facilities is a war crime, yet it still happens. So what's the impact of Israel's attacks on patients and doctors? This is Inside Story. Hello, welcome to the programme. I'm Adrian Finighan. Somewhere in the Israeli chain of command, a decision was taken to once again target Gaza's Al-Ahli hospital. The attack on the medical facility run by the Anglican Church came ahead of Palm Sunday, one of the most important dates in the Christian calendar. Targeting medical facilities is a war crime under international law. But that hasn't stopped Israel from doing so. The latest attack's been widely condemned, including by countries like the UK, staunch allies of Israel. So what's the impact on people in Gaza, those seeking treatment for illnesses nothing to do with the war, as well as those injured by Israeli bombs and bullets? How do doctors work under such conditions? And will there ever be consequences for Israel? We'll speak to our guests shortly, but first, this report from Victoria Gatenby.
Gaza's healthcare system is in ruins after 18 months of Israeli bombardment. The World Health Organization says Israel has launched more than 1,200 attacks on health facilities since its war began. The UN accused Israel of carrying out what it calls a concerted policy to destroy Gaza's healthcare system. Israel's attack on Al-Ahli Baptist Hospital in Gaza City on Sunday destroyed the last functioning hospital in the north of the Strip.
That's it. Al-Shifa Hospital is closed. Public hospitals are destroyed. Al-Sahaba Hospital is gone. This was the only hospital left handling surgeries, operations, intensive care, emergency, triage, everything. Even the pharmacy is destroyed, along with all the medicine.
Hospitals and medical services are protected under international law. This attack, like so many others on health facilities across Gaza, may constitute a war crime. Before Israel's war on Gaza, there were 38 functioning hospitals. The Ministry of Health says at least 25 are now out of service, meaning most Palestinians suffering from pre-existing conditions are struggling to access treatment. The UN estimates 45,000 people in Gaza have heart disease, 650,000 have high blood pressure, and more than 2,000 are diagnosed with cancer each year. They include Samir, who's suffering from leukemia. He's come to the Gaza European Hospital in Khan Yunis for treatment.
I'm calling on the Health Ministry and the World Health Organization for help. Medical tests show my son has cancer. His sister and brother have both died. He is the only one I have left.
This hospital is now the only place where cancer patients in Gaza are receiving treatment. That's after Israeli forces bombed the Turkish-Palestinian Friendship Hospital in March. It was Gaza's main facility for cancer care. Doctors say they're running short of chemotherapy drugs and medical equipment, and they say they live in fear of an Israeli attack and what that will mean for their already vulnerable patients. Victoria Gatenby, Al Jazeera for Inside Story.
We'll get to our panel of guests in just a moment, but first we're joined by Ahmad Al-Najjar, who lives in Gaza and has been reporting on Israel's war. Ahmad, what's it like for anyone who's sick in Gaza right now, anyone who has pre-existing or ongoing medical needs? You've got some personal experience of this, haven't you?
Well, Adrian, honestly, Gaza is not a place that you would want to be sick in. Everyone just praying, given everything we're experiencing right now, just to stay healthy, do not have to see a doctor or go to the hospitals. But unfortunately, that's not the case for many people who already before this genocide had their own medical conditions of different chronic diseases, of different illnesses like cancer patients, diabetes, kidney patients. It's just that the Gaza situation before the start of this genocide, there has always been challenges facing the patients, the people who are in desperate need for medical, especially treatment abroad and such thing. Personally, I had my own aunt 3 months ago. Before that, she was diagnosed to have the cancer, and the doctor just kept saying that she's in dire need of being evacuated to receive the proper treatment abroad, because the supposed treatment that she was supposed to be receiving in the Turkish Friendship Hospital, like the report just highlighted how it was bombed recently, is because it was the only haven for the cancer patients in the Gaza Strip to receive treatments. It was only a matter of 3 months after she was diagnosed, and eventually she passed away because she wasn't given the clearance to be evacuated for treatment abroad. And this is the case for thousands and thousands of people who suffer from different illnesses, different medical conditions, just deprived of the least right as human beings to receive treatment. And unfortunately, it's just not just about the patients, the people with illnesses, but those who are wounded and sustain injuries or wounds due to the Israeli continued attacks on the civilians in Gaza. The people who survive.
We're talking about physical health. I wonder what impact this war is having on people's mental health. How are people coping with the lack of food, the lack of clean water, the lack of basic medical services, and the constant threat of death?
Well, honestly, if you just, by witnessing what we are experiencing in the Gaza Strip, is perfectly sufficient to wipe out the sanity of any human being. Just to tell you how it impacts the mentality of the people here. The continued bombardment, the continued deprivation of the most basic humanitarian need, the continued running from one place to another, sheltering in different places, in the unknown, just hitting every week, and then due to the continued evacuation orders for the families here. And at the top of that, the physical suffering caused by the apocalyptic conditions created by the ongoing aggression on Gaza. People crammed in displacement camp after forced right now in Khan Yunis here in southern Gaza, where I'm staying right now, to evacuate their already destroyed neighborhood, their already devastated towns and cities where they returned to during the ceasefire, and now by the continued attacks here, forced to leave it again to head to Al-Mawasi, that Israel, or the safe zone that Israel is propagating as safe and humanitarian zone where they should receive all the humanitarian services they are in need of, but they come to deserted places, to areas that are arid of every basic source for just humanitarian services. The sources of water here are unfortunately contaminated. The conditions the people are put into, the families are just staying in tents, crammed next to another, in so inhumane scene, in unhealthy conditions. It would create the perfect atmosphere for the spread of different diseases, and that is what we are living here. About a year ago, like this time, the people were having this pandemic of hepatitis. Just tens of thousands of people were affected with this disease. Just walking to the street and seeing the people looking to you with their yellow eyes due to these inhumane conditions we are living in right now. And we have this actual fears that such pandemic would repeat itself again, Adrian.
Ahmed, many thanks indeed for being with us once again. I really appreciate that. That's Ahmed Al-Najjar there in Khan Yunis in Gaza. Let's bring in our guests. In Deir al-Balah in central Gaza is Olga Cherevko, a spokesperson with the United Nations Office for the Coordination of Humanitarian Affairs, or OCHA. In Amman is Dr. Tanya Haj Hassan, a paediatric intensive care doctor who's worked in Gaza. And in the Norwegian city of Tromsø, Dr. Gilbert, an emergency medicine doctor and senior consultant at the University Hospital of North Norway. A warm welcome to you all. Olga, let's start with you. Israel's latest strike on the Al-Ahli hospital has made an already catastrophic situation even worse. How close to collapse is the healthcare system in Gaza?
Thanks for having me and thanks for the invitation. Indeed, the health system is on its knees and it's been decimated over the months of fighting, and the months of destruction, and of course now being exacerbated by the fact that the crossings for the entry of all cargo, which includes humanitarian assistance, have now been closed for 7 weeks. If you go to the hospitals that are still functioning, there hasn't been a fully functioning hospital in Gaza for a very long time. There's been several partially functioning hospitals, but in those, obviously, the capacities are different. And now, with the renewed intensification of hostilities, the trauma patients, the mass casualties are basically the norm for the hospitals that are receiving these trauma patients. So they're obviously doing this with these mass casualties coming in on a daily basis as their supplies are running out, as their equipment is being worn out, and the essential equipment that they need to treat these patients does not exist. Some of it is waiting at the borders, at the crossings to enter, and the crossings remain closed. So it's a very, very catastrophic situation, as you mentioned.
Tanya, Olga paints a pretty bleak picture there. What does all of this mean to anyone who sustains a major injury or trauma, who needs any kind of life-saving treatment?
I mean, it's catastrophic. I was in Gaza February and most of March. I got back about 2 weeks ago. And during that period, before Israel rained hell on Gaza and unilaterally decided to break the ceasefire on March 18th, I was moving to Gaza City, back again to Deir el-Balah and Khan Yunis, and sort of moving between the hospitals. The organization I was working with was doing assessment of pediatric critical care services in those areas. And even at that time, so before March 18th, it was extremely difficult to seek care in different parts of the Strip, particularly for my specialty, which I can speak more knowledgeably about. It was very difficult for children to get an intensive care bed. The intensive care units in the past, so prior to 2023 October, were spread out throughout the Strip. There was a pediatric ICU at Kamal Adwan Hospital. Sick neonates and children were cared for at Al-Shifa Hospital, at Nasser, at multiple hospitals throughout the Strip. And if you're going to include NICU in that assessment, there were many hospitals that had ICUs. And at the time when I was in Gaza, in February and March of this year, every single intensive care unit in Gaza City in the north of Gaza had been attacked and destroyed by Israel. And as a consequence, the organization I work for set up a very small pediatric ICU and a very small neonatal ICU in a small non-governmental hospital called the Patient Friendship Benevolent Society Hospital in Gaza City. And all 6 neonatal beds, all 6 pediatric beds were always full. And so if you were a child, and I'm giving you real life examples, a child, for example, that had extensive burns and needed to be admitted to an ICU, there was no bed for you. And then you would have to be transported. This is a true story that happened while I was there amongst many. You would have to be transported in an ambulance to a further hospital, sometimes passing through an impossible checkpoint at times, where Israel was manning the Netzarim, or Israel had set up this checkpoint in the Netzarim corridor. And this particular child died in the period that they were searching for an ICU bed. And same thing if you were a newborn and needed intensive care services. So virtually impossible. And you started this program talking about cancer patients and the Turkish Friendship Hospital. It used to be the main hospital caring for all cancer patients except for the pediatric hematology oncology patients that were cared for at Rantisi Hospital. The Rantisi oncology unit was destroyed. I visited the remnants of it while I was there in March. And as you saw, the Turkish Friendship Hospital was very intentionally completely destroyed, brought to the ground. There are about 11,000 patients with cancer in Gaza at the moment. Until September, they had no access to chemotherapy. They were receiving only basic services for their cancer. There were no diagnostic tools or very limited diagnostic tools. Now there are about 70 new cases of cancer per week in Gaza. And they used to see about 400 consultations a day at the Turkish Friendship Hospital. They had about 800 inpatients there. It was hit the first time on the 25th of October of 2023. They moved their services to Dar es Salaam, to Nasser, to Abu Yusuf al-Najjar, back again to Nasser Hospital, and now to the European Hospital, where they're providing very limited services. Yeah. So you're having patients that would have curable cancer die of cancer because they have no access to care.
Tanya, I'm sorry to interrupt you. Let's bring in Mads. Mads, what was your reaction as a medical professional when you saw the scenes from Al-Ahli of patients having to flee it in the middle of the night with very little notice of an impending Israeli strike? Hospitals have special protection under international law. Now, Israel claims that Hamas was using the hospital and that it struck a command and control center there. Is that an acceptable justification for targeting it?
Number one, it's not an acceptable justification because the Geneva Convention is very clear. If you are attacking a mixed civilian military target, the precaution and the protection of the civilian people takes priority over your military gain. So even given that reasoning, it is illegal. But we know that these are flagrant lies. The Israeli army is lying all the time. And they've been accusing the hospital system in Gaza since 2006. Every time I've been there during attacks, they have been saying the same. Oh, these are command centers. They've not been able to show any proof of this. And let me remind your viewers that early after 7th of October, when the attacks on the hospitals started, the Minister of Health and the civilian Palestinian government in Gaza offered to have an international investigation committee coming to Gaza to examine the claims freely to see if there were any military functions in the hospitals. That was denied and stopped by the Israelis. So there are no proofs. But I'll tell you what my first reaction was when I heard about the attack on Al-Ahli. What kind of cowardice and sadistic army is it that attacks sick and wounded people in the middle of the night and attacks nurses, doctors, and volunteers who care for sick and wounded people in the middle of the night? I mean, it's so way beyond any moral standard that I don't understand why there is not more of an outcry and a fundamental accusation of immorality. It seems like there is a complete, not breakdown in the healthcare of Gaza, but a breakdown in the moral stance and the moral backbone of the Western government, who are not standing up. Listen, yesterday there was a very brutal Russian attack on Ukraine. 34 were killed. Yesterday, 37 were killed in Gaza, in addition to the attack on Al-Ahli. And yet it did not reach the news at all, almost not. Whereas the attack on Ukraine was condemned widely by all governments and all primary, the government leaders. So my reaction to the attack on Al-Ahli was a very strong feeling of disgust and disrespect to this so-called Israeli occupation army that do not have the courage to meet the military resistance, but attack the civilian part of society. And they do that on purpose, because what they want to do is to eradicate the social fabric of the Palestinian society. That's why they attack universities, colleges, public schools, archives, libraries, hospitals, primary healthcare stations, ambulances, whatever. Because the goal is not to fight down Hamas. The goal is to eradicate the Palestinian people and to have Gaza cleaned of Palestinians. It's called ethnic cleansing. And the attacks on healthcare is a very, very calculated part of that political strategy. Of course, illegal, condemnable, and extremely inhuman.
Olga, You heard what Ahmad had to say at the beginning of the programme about his aunt who passed away after suffering cancer. With Israel ignoring international legal protections for civilians in Gaza, what impact is this having on people's physical and psychological suffering? They're under an enormous amount of stress. Where do people with pre-existing conditions or life-threatening chronic conditions go for treatment?
That's exactly right. I was just actually talking to some people in a site for displaced people in Khan Yunis earlier this afternoon, and there are a number of people with chronic diseases, and one of the women was showing me the medicine that she has to give to her husband, who is diabetic, and all of these procedures that she has to follow. But she doesn't get enough medication. She cannot afford to take him to the hospital when things get bad, because the only way to transport people now is either by a donkey cart or in a car. But obviously, there's no fuel, so things are very, very expensive, and people cannot afford even putting somebody on a donkey cart. So they hand carry the patients to the available facilities to try and save them. And I shudder to think how many preventable deaths are happening here on a daily basis just because this continues. And we continue to just face challenges on a daily basis to save lives.
Tanya, the UN says that pregnant women have suffered gravely as a result of the war. What impact has this deliberate targeting of healthcare facilities had on pre- and postnatal care and on maternal and child mortality?
Absolutely, Adrian. But before I answer that, I think I want to focus on your words, deliberate targeting of healthcare. I was at Al-Nasser Hospital this last month when the hospital was bombed. They bombed the floor exactly above me while I was in the emergency department. I was watching the news last year when Al-Ahli hospital was bombed, and Israeli spokesperson came out on the news saying we would never target a hospital. There was so much shock and horror around the world about that particular incident that a hospital could be bombed, and Israel denying that it would ever do such a thing. And fast forward over a year later, and Israel has bombed virtually every hospital in the Gaza Strip, and openly so, admittedly so, and sometimes bragging about it. And it's very scary to see us go from shock and horror about one hospital being bombed to desensitization. It's yesterday's news. Yeah, they bombed Al-Ahli hospital. Of course, why not? Why wouldn't you destroy an emergency department, one of the last remaining emergency departments for all of the population living in Gaza City in the north of Gaza at the moment? And we're just talking about infrastructure right now. So many of our colleagues have been killed. And I think about my colleague who was at Al-Ahli hospital every single day for several months now, while caring for his family at the same time as they are displaced from one place to another. And he told me yesterday that he had a child come in that he was caring for the night that Al-Ahli was bombed, that had a penetrating shrapnel injury going through one side of the brain to the other, lost most of his family. And he said, I went home to sleep, and I woke up to this very terrifying sound of nearby explosion. Turns out they bombed Al-Ahli hospital, and I don't know what happened to that child. I mean, that's a child that would have needed very quick and very intensive type of medical care that could not have been provided as a hospital was being evacuated and bombed. And so I expect that child probably died, as many other children, as a consequence of these sorts of attacks. The oxygen generator was also bombed, along with virtually every oxygen generator in the Gaza Strip since October 2023, and not a single oxygen generator has been allowed by Israel into Gaza. I say all of this to say what is very clear is a pattern of attacking life and everything need to sustain it. And what Israel spokespeople and authorities and military spokespeople do over and over again is they blame the attack on others, guises it as a justified attack on a threat that myself physically in the hospital and everybody else I know who's volunteered in Gaza will tell you over and over again, we never saw any Palestinian military activity in any hospital. Then as soon as there is no evidence, they say it was a human error to be investigated, of course, and then we lose sight of it and there is no international investigation. So it's utterly infuriating, Adrian, as a healthcare worker, to watch this be normalized. And it's also terrifying because it will spill over into other contexts. As soon as you're able to dehumanize a population, you will start to accept these things.
All right. Matt, you talked about the deliberate targeting of medical facilities somehow playing into Israel's strategy. Why is Israel allowed by the international community to carry on attacking healthcare facilities with, it would seem, impunity? Will there ever be consequences, you think, for Israel after this deliberate targeting of healthcare facilities in Gaza?
Well, I think that's the $1 million question. Why is it that Israel has been embraced with this impunity for the last 75 years? We heard Ahmad talking about the epidemic of hepatitis. And let me just also mention that I talked to the Minister of Health, Dr. Youssef Aborish, the other day, and he told me that Israelis are denying the entry of polio vaccine to 600,000 children in Gaza who need their second dose to be fully covered. They will not allow that vaccine in, which means that with the condensation of people into smaller and smaller areas, the risk of contamination and spread of disease will increase drastically, and there will be a polio epidemic.
Matt, so I've got about a minute. We have a minute left. A minute left.
Yeah. Two important studies that have been published in The Lancet. One showed that the numbers of killed is 41% too low, the numbers that we discussed. The second study, very important, shows that the sum of the hardship, the lack of food, water, healthcare, the attacks, has diminished the life expectancy in Gaza by 35 years in 12 months. So before the 7th of October, the average life expectancy in Gaza was 74 years. Now that has been diminished by 35 years, which means a half of a life that you can expect to live in Gaza. That says everything about the summary effect on the attacks on the living conditions, on the attacks on water and food and medical supplies, and on the attacks of healthcare. This is a deliberate ethnic cleansing. This is a genocide, and the attacks on the medical system is part of the genocidal politics of Israel.
I'm afraid we're going to have to leave it. Many thanks to you all, Olga Cherevko and Doctors Tanya Haj Hassan and Dr. Max Gilbert. And thank you for watching. You can see the programme again at any time by going to the website at aljazeera.com. For further discussion, join us at our Facebook page. That's at facebook.com/AJ Inside Story. And you can join the conversation on X, our handle there at AJ Inside Story. From me, Adrian Finighan, and the team here in Doha. We'll see you again. Bye for now.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.